My name's Elwyn Trath. I come from Nyngan. I'm a retired shearing contractor and I've worked in the country areas all my life. Presently I'm down here for a treatment for leukemia, and I'm lucky to get this residence here. It's unbelievable what these people have done here in Nyngan to help people out who can't really afford to stay at motels all the time. Macquarie Stay has beautiful staff. They help you so much, and they do all the accounting side, which is, it's a terrible, for blokes like myself, we've never turned around and had to do anything like this. And the way they help us out in presenting our accounts, and the cost saving is unbelievable, because that means a 160-mile trip, that's 320 kilometres a day if I had to travel up and down. And for five days straight, and you're getting needles and everything for your, for the leukemia injections. It's nearly impossible. We wouldn't be able to afford to undertake the treatment. So we're very lucky to have Macquarie Homes here.
My name's Casey Davis-Banks, and I'm here at Macquarie Homestay because I am 28 weeks pregnant and I'm a high-risk pregnancy. So there's issues going on with my body. So I have to stay here because the place that I live, Cobar, it's about a 3-hour drive, doesn't have the facilities. So I have to stay here in case I go into early labour so that me and Bub will both be safe.
Reggie surprised us by being 3 weeks early and weighing just under 2 kilos when she was born. So she did have to stay up at the special care nursery for a while to get looked after. Which, is overwhelming, of course, and they don't have any room for the moms to stay up at the hospital with Bubs. So, and of course, all I wanted to do was just be beside her the whole time. Honestly, I was prepared to sleep in my car outside of the hospital. But then the staff there told us about our house. So we went down to have a look, and I was amazed at it. It was perfect. It was what we needed, and I could be right there near her and have somewhere comfortable.
I decided it was easier for me to stay here in town while I was having treatment, and Lilia Lodge is the place to be. And so I stayed here for the full term of my treatment.
I'm 2.5 hours away from, a major town, like a big town like this, to get treatment of that. Well, coming over here, I thought, I couldn't drive 5 hours a day. Do 5.5 hours of chemo, within an hour of radiation, every day, and then try to drive home. Not a chance. You come back here and at least you had a bed to fall into, and we had someone to talk to.
I think the sad part of anybody being sick is being on their own. But this place, no, you're never on your own here. No way.
Places like this for the country people, especially you go to town once a month, and then you come down here. I was freaking out when I come down here. I didn't know what was going to go on. I couldn't have done that treatment and then drove home. Not every day, and for 6 weeks every day.
Yeah.
It was too hard. This place was brilliant.
Yeah, absolutely fabulous.
Yeah. It's been nearly 3 years waiting for a heart transplant. And during those 3 years, we have constantly stayed here to go to either Sydney or to the hospital here, Double, to see the cardiologist and so on. Sometimes when I was put into hospital, my wife would stay here as well, waiting for the results or going to see me at Double-based hospital. The actual heart transplant virtually cost us every cent that we had. We are very, very lucky to be able to have a roof over our heads in that capacity, to have a second chance in life.
Specialist treatment centres are typically located in major regional and metropolitan centres. As a result, people from right across New South Wales travel to receive specialist medical care. In metropolitan areas, the distance of treatment can be easily facilitated. Access to public transport, friends and family to support a short trip is achievable. However, patients from regional New South Wales face different challenges. For some, travelling 1, 2, even 4 and 5 hours one way to seek specialist medical care is a major event requiring planning, time off work, needing to arrange somewhere to stay, let alone the cost of major travel and accommodation. That's when the Regional Accommodation Providers Group provide a vital lifeline. Our accommodation facilities provide their home away from home. Each one has been established as a not-for-profit charitable facility. Our drivers are not about maximising financial gains. Yes, we need to run at a modest profit so we can continue to invest in our facilities. But more importantly, we provide that safe, supportive environment that supports patients, their partner or carer, and family while they access specialised medical care. While many of our guests are receiving cancer treatments, our accommodation supports people accessing a wide range of treatments and services that these major referral hospitals provide to have their baby as a result of an accident and emergency. Paediatric care, mental health, orthopaedics, ear, nose and throat, dialysis, day surgeries, diagnostic testing and scans, specialist appointments, surgeries, intensive care, palliative care, rehabilitation, and so much more. For some travelling to see a specialist, they may just need a night's stay. However, for others, their needs are far greater. A mum who is deemed a high-risk pregnancy may need to be close to birthing facilities many weeks or even months prior to their due date. That's time away from their support network, family and friends, away from work and in a different environment. A cancer patient receiving radiotherapy may receive treatment every day for just 15 minutes a day over a course of 6 weeks. What do they do for the rest of the day? A patient who has experienced a life-changing event may require intensive care, surgeries and even rehabilitation. Family rally to be with them. They support each other and in some cases, sadly, they have to say goodbye to their loved ones. A patient requiring dialysis may not have a chair available at their local MPS and must receive dialysis away from their home. Some patients have relocated for 6 months to receive this life-saving treatment. And that's where regional accommodation providing group facilities come into play. We provide that home away from home and support the patient while they're away receiving their medical care. We provide culturally appropriate, safe and welcoming facilities that meet a specific need across regional local health districts.
Every week they have a little barbecue or something on, and all the different service clubs come down and providing it, and they come down and help you out. It's just unbelievable. I didn't think that charity still existed in Australia. It's just unbelievable. You meet people from all over the place, man, we haven't seen for years, but we interact so well. Everyone all cooperates and helps. You walk into the kitchen now and everyone don't expect service. They all hop in and wash up and clean up and converse, something which you don't get if you're stuck in a motel or a hotel trying to get treatment, and this way it all helps with you to get you over the burden of what you're suffering and what you get or what you've been treated for. You know, it makes it a bit human, very human. Just like the people turning up just to give you meals. Oh, it's just unbelievable.
Like the first night I went in, they were, offered me like a barbecue steak, and man, did I ever feel like grateful and cared for and looked after and part of the community too. It's a home really for people that are going through those challenges. I really felt loved there, and that I'll always be grateful to them.
Macquarie Homestay has been like godsend because it's extremely cheap and it's been very helpful for me and my family. Being so close to the hospital, so it's a lot more accessible to someone like me. And it's just been so easy. They've got great facilities and it's just easy access all around. It's pretty good to run into other people that are staying there and swap stories. Makes you feel less alone.
The atmosphere of Lilia Lodge, I think it made our stay a lot easier, a lot better. It was so relaxed, and everybody, management, cleaners, workers, volunteers, everybody was just so relaxed.
We are so much more than a motel. We work with social workers, midwives, Aboriginal medical services, specialists and GPs, hospital administration staff, right across each health service. We help complete patients' IPTAS forms. Where we are able to bulk bill, we do so, and the accommodation subsidies reducing patients' out-of-pocket expenses make a profound difference. We make sure patients receive their travel subsidies, and we help lodge the forms for patients. State regional plans identify that the health sector represents major economic growth opportunities. Our major regional communities are hubs for health services, and as these opportunities grow, so too will the demand on our accommodation. We support many areas within many local health district strategic plans. Regional accommodation provider group members actively contribute to implementing key recommendations from the Inquiry into Health Outcomes and Access to Health and Hospital Services in rural, regional and remote New South Wales, particularly those relating to specialist care and service delivery. There are many reasons why the partnership between the New South Wales Government and regional accommodation provider group members are critical, and they are outlined in your briefing document. In isolation, regional accommodation provider group members are a jigsaw piece in a puzzle of regional healthcare, but our facilities are a key piece in connecting services, patients to treatment, and regional health and wellbeing. 39% of New South Wales residents reside in rural, regional and remote New South Wales. Regional accommodation provider group members are independent, charitable accommodation facilities providing an essential service for community that also supports best treatment outcomes, health service efficiencies and saves New South Wales Health money. We increase the effectiveness of what New South Wales Health provides by reducing barriers that may exist to patients, such as cost and access. We provide bespoke facilities. Our communities fundraise for us. They support our establishment, expansion and operations. We provide a place for volunteers to contribute to community, increasing social cohesion. We help close the gap by improving social inclusion and connection. Many Aboriginal people experience social exclusion when navigating the healthcare system. Social and economic disadvantages are barriers to building social inclusion and improved treatment outcomes. We have new and expanding facilities. We, as members of the Regional Accommodation Providers Group, seek your support as our elected representatives to help our facilities deliver life-saving, essential services for our communities.
Our house supports regional patients and carers by providing accommodation. The patient might be in hospital or the patient may be going through treatment, renal treatment, cancer treatment, whatever sort of treatment. So I think really our house and our facilities like this around the state are part of people's treatment and part of people's support network when they're going through tough times with their health. For an average guest here would have been about $1,000 a stay minimum, depending on how long they stayed. That's say if they're staying a month, if they're staying more, $2,000, so on and so on. And, you know, the majority of our guests here are 70 plus and they're on a pension. You know, they can't afford it. So it really starts to make a massive, massive difference to people not questioning, can I afford to go and have this treatment? We hate to ever think that the answer would be no. But IPTAS makes a difference. IPTAS is the way they can afford it, and it's just so wonderful. And when people find out about it, they're just like, oh, wow, that's amazing. They do that for us. In relation to having a carer can definitely stay here with the patient. About 50% of our guests have carers. That doesn't cost any more under the IPTAS scheme. It's just included, so we really appreciate that. But we also have carers staying, you know, when the patient is in hospital. That's again covered by IPTAS, and that is such a blessing for the family member that's in hospital. This is really making a difference to people's lives. This is real. You know, that's so special to provide that service. It makes me a bit emotional, but it is. It's just it's real. Like this is people's lives, and without these treatments, they would probably die. So you can't do anything better than that. Yeah.